Hi, my name is Dr. Carla Kassler. I'm a licensed acupuncturist in California, and I work with Acupuncturists Without Borders, a nonprofit organization that uses acupuncture to reduce stress, trauma, and pain in communities affected by natural disaster, environmental devastation, social injustice, and human conflict. We use a very simple ear acupuncture treatment called the NADA 5-needle protocol to help regulate the nervous system in stressful situations and after traumatic events. The treatment also has a very strong effect on the emotions. It's simple, safe, and very effective. We can do this treatment without needles, instead applying the tiny seeds attached adhesive to acupoints on the ears. We call them ear seeds, and they can stimulate the acupoints in the ear just like needles, except that they don't penetrate the skin. I'm going to show you how to do this simple treatment in this video. First, I'll show you how to apply the ear seeds to somebody else's ear. Then I'll show you how to apply them to yourself. Before I show you how to locate the points and apply the ear seeds, I want to tell you a little bit more about the points and what they do. As I said before, the NADA protocol is an internationally recognized ear acupressure treatment that helps reduce stress, trauma, and secondary trauma. It was developed at Lincoln Hospital in the South Bronx in the 1970s. It consists of 5 points, including the Shen Men point, the sympathetic point, the kidney point, the liver point, and the lung point. And I want to tell you a little bit about the effect that each point has on the body and the emotions. First of all, Shen Men, which means spirit gate in Chinese. It helps calm anxiety. It slows down the heart rate. It alleviates feelings of impatience and mood swings and helps the person feel greater joy. The sympathetic point helps relax the nerves. It balances the autonomic nervous system. It reduces the fight or flight response. It improves digestive function, helps with breathing, relieves anxiety, and produces a sense of calm. The kidney point helps with relieving fear and paranoia and anguish, and it helps fortify feelings of gentleness and awareness. It is deeply restorative and rejuvenating. The liver point helps deal with stress. It helps cleanse the body of toxins. The liver is associated in Chinese medicine with feelings of anger, rage, and depression. So stimulating the liver point helps with these symptoms. It helps to restore emotional balance and kindness. And finally, the lung. The lung point nourishes and improves the immune system. It helps relieve shortness of breath, and it helps people breathe easier. It's associated with grief, so it helps when there's a lot of sadness and grief and helps the person gain greater resilience. Together, these 5 points work on the body, mind, and spirit to help create a sense of well-being and balance. People who have experienced this treatment have reported reduced stress, anxiety, and pain, as well as improved sleep, focus, and mental clarity. And now I'll show you how to find the points and how to apply the ear seeds. So let's look at some ear anatomy before we start. This is the helix of the ear, this kind of curled structure on the outer ear, and this is the root of the helix. Helix root, helix. This is the triangular fossa, shaped a little bit like a triangle. This is the antihelix, which is the other ridge that's more internal to the ear. Antihelix. This is the cavum concha, and this bump is the antitragus. There are 5 NADA points. You can see that I've marked some of them already inside her ear, We'll go over them one by one, and we'll go from superior to inferior. The first point is called Shen Men, spirit gate. It is in the triangular fossa. If you divided the triangular fossa into 4 quadrants, it would be in the posterior superior quadrant, like an eye of a fish. If you could imagine that the pointed end of the triangle is the fish's nose, that's the eye. Shen Men is the eye of the fish. That's the first point. The second point you cannot see from the outside. It's called sympathetic. It's inside, underneath the helix, where the antihelix meets the helix wall. So it's inside on the top ridge of the antihelix, underneath the helix curl. The kidney point is underneath the antihelix ridge below Shen Men. So go down from Shen Men, go underneath the antihelix ridge, and again, you can often not see it to the eye from the outside. It's right underneath that ridge below Shen Men. Now this is the helix root. Liver, which is the fourth point, is where the top ridge of the antihelix meets the helix wall. You can see it. And the fifth point is lung. It's in the cavum concha, in the darkest part. It's below Shen Men and kidney in that line. Go over the antitragus, down into the cavum concha, and that's where it is. So Shen Men, sympathetic, kidney, liver, lung. These are the 5 nada points. Here's what you'll need to apply ear seeds to someone's ears. Ear seeds, an alcohol swab, and some tweezers. So I've marked some of the points. Here, the first thing you're going to do is have the person clean their own ears. This is important that they be part of the process. Now, after you've looked at the ear, you're going to start with Shen Men at the top, and you are going to mark the point if you like. I marked it with a little Sharpie. You can do that. Remember, this is the superior posterior quadrant of the triangular fossa, and you are going to put the ear seed, which you've taken off the palate with tweezers, and put it right on the point, and you're going to press so that you make sure it's adhered properly. Unfortunately, the adhesive is only one color. It doesn't match most people's skin, but it stays on pretty well. Now sympathetic, which is the hardest point because you have to go under the helix curl and press, make sure it's adhered well. It's where the antihelix top ridge meets the helix underneath the helix. And I like to kind of make sure it's snug in there with the tweezers. Often the points are a little sensitive, so the person will tell you if it's right. Now, kidney underneath the antihelix ridge in a line below Shen Men. And I'm pressing upward and in to make sure it's adhered. Liver, you can see, so it's not difficult to put the adhesive on. That's the top ridge of the helix root where it meets the antihelix. And again, that one's often a sensitive point, so the person will go, ooh. And then lung. I'm pulling down a little bit on the lobe so I can get into the cavum concha. You don't have to be perfect with your point location. This is a regional treatment. So make sure the adhesive is well adhered to the ear. The person can press on the points themselves for 30 seconds a few times every day. You can keep them in for 3 to 5 days, and you can take a shower with them in, no problem. Now we're going to show how to put the ear seeds in yourself. You'll need a mirror for this. I'm actually looking in a large mirror. You can use a small makeup mirror. I'm cleaning my ear, and I'm going to go first for Shen Men. I can see that one pretty well in the mirror. Again, superior, posterior quadrant of the triangular fossa. Now I'm going to do sympathetic, which is hard to see. It's a blind procedure. So I'm going to try to put it right in there, and I'm going to feel around for the point. Usually the most sensitive point is the right one. Sometimes you can kind of move the seed around underneath the adhesive and get it on the right spot. So that's adhered well. Notice I have my hair pinned back. That's a good thing to do. Now I'm going for kidney underneath Shen Men in a line underneath the antihelix ridge. So I'm pressing it up underneath, making sure the adhesive is strong. Again, sensitive. Now liver, where the helix root meets the antihelix wall. This point is usually very tender on most human beings, especially in stress situations. Making sure the adhesive is on well. I'm actually going to do that one again, and the reason I'm keeping this in the video is that you'll want to practice and you'll get it right, and you'll get it not as right, so you might as well know that even an experienced person doesn't always get it right. You can practice. That's better. And finally, I'm going to do the lung point, pulling down a little bit on the lobe over the antitragus into the cavum concha. Making sure that everything's adhered and secure.